So we have helped so many people stop their knee and hip pain simply by changing their walking pattern or gait.
And here is a real patient's response after we changed her walking pattern.
It's amazing. Just in the short period there, the pain's not there. I don't feel like my knees are lacking, which I never really paid attention to. No, it's a significant difference to walk that way.
So now we're going to show you why the decrease in pain that this patient, Renee, actually felt. Okay, so it's very important that you understand why this works so well and decreases pain. If we use Sam, our skeleton, I call him Samula today, and when the heel strikes, the ankle is actually pulled up or dorsiflexed. That puts the ankle in a closed pack or a very solid position. So all the impact is going to be transferred through the heel, and then it goes to the knee because the knee is locked out. The force is going up this way, and look at the knee. Every time you heel strike, this happens. Now, I'm exaggerating a little bit, but a little impact goes to the joint each time. Now, if you have a sore knee or arthritis, that is going to amplify and really degenerate that joint faster. The same thing happens in the hip. Every time you heel strike and we look at the hip, it's going to get pushed up into that acetabulum or the socket, and there's a continual interruption or impact every time you walk. So if you walk a mile, that could be hundreds and hundreds of impacts. So we're going to show you how to soft knee walk, which eliminates that impacting all the time, and the knees and hips are happy for you.
To test this out, first at home, take off your shoes and socks and make sure you're walking on a hardwood floor, or if you're outside and you got some cement, you can certainly try it there. Do your normal walking pattern with heel striking. You'll notice you'll feel an impact force from your ankles, knees, hips, even in your low back. Now, try to walk with a bent knee like this, landing on your forefoot. Feel less impact forces and your joints will start to feel better.
All right, so we call this soft knee walking when you walk on your forefoot in a slight bend. Mike is going to instruct you on how to train yourself to do this in a real efficient manner.
To start practice walking like this, we suggest doing it in your house first in your bare feet because most shoes have elevated heel and it's going to impact the way you walk. So to begin this, what I'm going to do is land on my forefoot. I'm going to take smaller steps and I'm going to go nice, slow, and controlled. This will feel a little awkward at first, especially if you're used to taking long steps and heel striking like that. So just take your time. It's going to put the pressure through the muscles and engage them much more than putting pressure directly on the joint, helping save any arthritic pain you may be having. Another component to walking correctly is actually engaging your glutes or your butt muscles while you're walking. This will again help take pressure off of your joints. To do this, simply place your hands on your buttock and walk your normal walking style. Feel how much each buttock cheek is engaging. Now what I'm going to do is I'm going to walk actually on my tiptoes if you're able to, and notice the difference in how much your glutes are actually engaging. Again, you probably want to do this inside, not walking around outside looking like this, but you should notice a big difference. Now, you're not going to forever walk on your tiptoes. This is a little awkward. But when you start walking forefoot walking, you will notice that your glutes are engaging, and this is the correct way to walk. So I've personally done this walking method, and I changed it roughly just a year ago, and it takes some time. You have to start out with smaller steps. It's gonna feel a little awkward, but with patience and persistence, eventually it'll become more natural. You'll notice you won't be able to walk as fast initially, but that's okay. Over time, the gait pattern will start to feel normal, and I actually don't have any knee or hip pain now. I was experiencing a minor amount of hip pain before, but that has since resolved itself.
Man, he's only 35.
Bob and Brad.